Hi, my name is Katie Clyde, and I'm going to show you what is in my physical dysfunction kit. So first, we have some large printed word searches and coloring books. And these are great for improving memory, focus, vocabulary, and overall mental acuity. Word searches emphasize pattern recognition, which is a key cognitive skill. The large printed letters in the word search will allow a person with low vision to visually track the letters without straining the eyes. Not only do you have to visually track the letters, you have to hold a writing utensil to circle each word and be able to pick out the word that you're looking for. The intricate pictures in the coloring book require more fine motor skills because of how small they are, and they need more fine motor to be able to stay in the lines as well as flipping through the pages of the book. And both of these activities are great because they address skills such as cognition, working memory, visual tracking, fine motor, sequencing, color recognition by using the different colors, crossing midline, and many more. The second activity we have is the beach ball. And using a beach ball can be a fun way to get your client motivated in activities that address several motor skills. Simply tossing the ball back and forth can develop gross motor skills, postural stability, and bilateral coordination. Playing with a beach ball will encourage coordination skills, muscle strengthening, balance, sensory stimulation, and spatial awareness. The client can see how long they can try and balance the ball on top of their head. They can try to increase how long they balance it each time. They can try and hit the ball with different parts of the body, just like the elbow, promoting body awareness and seeing if they can identify what part of the body that they are hitting the ball with. And they can also encourage social participation by throwing and kicking the ball back and forth or playing a game that requires teamwork. So beach balls are great to have in your kit. The next activity I have are some resistance stretch bands. And they come in 3 different resistances. The pink is going to be the lightest resistance. The blue is going to be a medium resistance. And the red is going to be the heaviest resistance and the strongest. The use of these bands can help improve strength, range of motion, and gross motor skills. The more you use these bands, the more your strength and endurance will improve. These stretch bands can address several different muscle groups throughout the body. They are made out of latex material, so anyone with a latex allergy would not be able to use them. So these are great to have in your kit. Next activity we have are some craft sticks. And these are great for therapy because of how many skills they address and how many different ways they can be used. A client can build different things with them, they can glue them together, they can paint them all different colors, they can stack them on top of each other, and so much more. The repetitive motion of stacking the sticks on top of each other can be calming to a person and allow them to problem solve and to develop their cognition. Craft sticks can address fine motor by manipulating them in hand, as well as crossing midline to create a picture. The wooden texture of the sticks will help stimulate a person's senses and help develop their sensory skills just because of how they feel. And using craft sticks can also address skills such as fine motor, sensory, bilateral coordination, hand-eye coordination, initiation and termination, sequencing, crossing midline, color recognition, and many more. So these are fun to have. Our next activity is going to be some self-care activities. We have a brush, a toothbrush, and some fingernail clippers. And these items are great to use in therapy to address the important self-care skills that a patient needs. It's important to address these skills to be able to get the client back to their maximum independence level. These items can be used in a simulated or real environment to refine and master self-care skills. You could go through some passive range of motion or some hand over hand to develop those skills if they don't have them yet. Using these items can address the fine motor that they need, self-care, cognition, sequencing, doing everything in the right order, hand-eye coordination, bilateral coordination, and spatial awareness. So those are great to have in your kit. The next item I have is a deck of playing cards. And these playing cards can be used in several different ways to address important skills. They can be used to develop in-hand manipulation by dealing and shuffling the cards. They can be used to build a house, stack them on top of each other. They can be used to help with cognition and and memory by playing memory games and counting the cards. They are great for socialization purposes by interacting with others while playing different games. Other skills that can be addressed with playing cards are sequencing, color recognition, crossing the midline, fine motor, initiation and termination, hand-eye coordination, the trunk stability, head control, visual tracking, and more. So these are fun to have. Our next activity is going to be some playing dice. And the use of dice in therapy can be very beneficial for a client. Playing with dice can be engaging for a person and address several skills at the same time. Manipulating the dice in each hand will develop fine motor skills, and the client can also work on different pinches with the dice. Using dice can promote problem solving and reasoning and communication skills while interacting with others while playing a game. They can also address cognition and memory by counting and recalling the number of dots on each side. Playing with the dice can help with upper extremity range of motion by tossing the dice and having to reach out and grab it. Hand-eye coordination, sequencing, visual tracking, color recognition, crossing midline, working memory, and many more can be addressed with the use of dice as well. Our next activity is going to be the use of rubber bands, some smaller rubber bands. Using rubber bands is a great way to encourage fine motor skills and muscle strengthening of the small muscles in the hand. There is a thin rubber band and a thick rubber band in the kit. The thicker ones have more resistance when stretched compared to the thinner ones. You'd need to pick one that's appropriate for the client so that they don't strain their hands too much. Placing a rubber band around selected fingers while opening and closing them will increase strength and work on range of motion in the fingers. These rubber bands can address hand-eye coordination, crossing the midline, initiation and termination, and several different skills like that. So these are great to have in your kit. The next item I have is some multicolored paper clips. And the use of these paper clips can be a simple and fun way to address several different skills. Fine motor control will be needed to manipulate the paper clips in the hand as well as pulling them apart. These paper clips come in several different colors, which can address color recognition and visual tracking of the colors. The client can choose to make a bracelet or a necklace out of the paper clips, which will address cognition, working memory, fine motor skills, range of motion, visual tracking, and bilateral coordination. They can also be used as a socialization tool for making bracelets and necklaces for other people and giving it to them. Using paper clips in activities that require counting and memorization will encourage problem solving and cognitive skills. So these are great to have in any kit. Our final activity for our kit is going to be our mini sewing kit. And sewing kits are great to use in therapy because they promote communication and reminiscence if it's something that the client enjoyed doing. This kit contains needles, which would be a precaution when using with the client. Sewing requires people to focus both physically and mentally on a task. It can promote cognitive development as well as working memory by making a specific pattern. It can be done in a social setting, addressing communication skills. Fine motor skills are required to be able to thread the needles through a specific hole or to sew a button on the pants. Sewing can also stimulate the senses by having different thicknesses of threads or different textures on the threads. It addresses ADLs such as dressing if a client ever lost a button to a shirt or pants and they could sew it back on. Other skills a sewing kit addresses are sequencing, initiation and termination, bilateral coordination, crossing midline, hand-eye coordination, upper extremity range of motion, visual tracking, color recognition of the different threads, and many more. So that is all I have in my activity kit, and thank you for watching my presentation.